I'm speaking with Professor Andrea Piloni, who is a professor of periodontology at the University of Rome in Italy. Thank you for coming to speak to me. Can you tell me a bit about your presentation that you did today?
Well, my presentation was basically involving technology, because we are looking into technology as a new tool for preventing periodontal disease and trying to save teeth, because periodontal disease is very much prevalent now. And as a matter of fact, in the first part, I showed new data coming from WHO, World Health Organization people, that are telling us that the number of people affected by this disease in Europe is almost the same as the number of people affected by the same disease in the African countries. So no matter what, regardless the type of strategies for preventing this disease, which is at the end involving the loss of the tooth, and having too many people involved with implants, now we need to go back to not only cleaning mouth of our patients, but control the infections with technology which is manual or instrumental electrical, and technology for regenerating tissues, like tissue engineering. And one of the new insights about this topic of the field of periodontology is that nanotechnology is capable of organizing cells in a better way to regrow tissues like cementum around the root, periodontal ligament. So we're into something quite interesting, and of course we need the help of somebody or some institutions or governments that are into not only tissue engineering for teeth, but also for medical science in general. But I was happy to see the majority of the participants interested in knowing the data about the prevalence of the disease. Still very high all around Europe.
What were some of the interesting questions that were asked you by the people who were listening to your presentation?
Well, the most something that I found very important in terms of quality of questions is that something like this: what can we do as hygienists in the private practice? What can we do as dentists? Not only private practice, but also in hospitals. And I think that the major role played by both hygienists and dentists in this issue is to talk about it. Because unfortunately, periodontal disease is a very bad disease that takes to the loss of the tooth, but has no symptoms. In general, our patients get only some bleeding while they're brushing in the morning or at night before they go to sleep. There are no symptoms in terms of pain. So when they face the story of getting some dental consultation for the first time, sometimes it's too late. So the only way of preventing and getting people sitting next to a dentist or a hygienist when advanced is to talk about it. Okay?
Professor, thank you very much for your time and for speaking with me. I'm speaking with Nadine Merlenberg, who's with us today. She's just presented as part of the Hygiene and Dental Therapy program, and she works for DMG, specifically on the ICON product. Nadine, thank you so much for coming to speak to me. Can you tell me a little bit about what you spoke about in your presentation today?
Of course. Well, the main idea behind ICON is that we want to prevent drilling and filling. ICON is a special treatment to treat an active caries disease without taking the drill. That means it's a 3-step treatment where you etch the surface, you dry it with ethanol, and then you applicate a special designed resin, which is ICON, which is able to infiltrate into the tooth. Then you licure it and it encapsulates the caries so you don't have to drill. Absolutely innovative and brand new.
So what are some of the questions that come up when you tell hygienists about this particular product?
Well, normally the people are afraid to leave the caries in the tooth. And I can understand that because I'm a nurse as well. And it is a rethinking in dentistry right now to leave the caries in the tooth. But we did a big effort of studies. We did research for over 10 years about this ICON topic with different universities all over the world, and it works. We have a success rate of 94% to arrest the caries reliably.
So the whole idea, it's part of the minimum intervention trend that we're seeing in dentistry, where you leave as much of the tooth structure behind and not interfere too much. So you are based in Germany, but I presume you present all over Europe. Do you find that some people are really skeptical about the efficacy of the product?
Of course. My experience is that when a new product, a new treatment is launched, dentists, therapists, and hygienists are always skeptical about the outcome. And I can understand that because it's their head which falls off if it doesn't work. But I see all over the world a great success because the way goes into the minimally, or I call it micro-inventive dentistry, and this is one way of treating, and I personally am sure that this infiltration therapy will be a stone in dentistry, a stone in the therapy method, like filling and like prophylaxis. It will be regular, it will be well known, and it will be used. I'm sure.
We can expect to see more of this kind of intervention, as you say, a micro-intervention.
I'm absolutely sure, yeah.
Nadine, thank you so much for speaking to me about it today.